Today's video is going to be discussing integrating overdose prevention and response messages into a substance abuse treatment setting. This is an important place to integrate the life-saving information about overdose for patients, not only for themselves and their own potential risk for overdose upon relapse to substance use, but also their families, friends, and communities who may be experiencing the effects of drug use still. When integrating overdose prevention into a treatment setting, the first tactic is to begin a conversation with the client around their experience with overdose, asking simple questions about whether or not they have ever overdosed themselves or witnessed an overdose, and what was that experience like. Often, the provider will find that the client has experienced possibly multiple times overdose situations in their lives, whether it be their own or someone they care about. This can be a traumatic experience for people that often, once the stage is set to have that conversation, they're ready and willing to actually explore those experiences with a provider. If the patient or client is uncomfortable with discussing their own overdose risk, the issue of overdose prevention can be approached by talking about the people in that person's life that may be at risk. You may know someone that is still actively using that you're worried about. Having overdose prevention training empowers you to have the information and skills that are needed to respond effectively to an overdose and save the life of someone that you care about. These are the kinds of messages that you can introduce this topic to your client while not approaching them necessarily around their own potential for relapse if you feel as though that's a sensitive topic with the person. It is also important to discuss relapse with someone who's being discharged from drug treatment. Talking about relapse does not cause relapse, we know this, but it is an important place to say, this is a possibility. If this happens, we want you to be safe and okay. Here are some ways of preventing overdose. If you experience overdose, we want someone to be there with you to save you. Please convey the information we're about to give you to those that care for you, that you may live with or surround yourself with. Talking about overdose with one of your clients can be a brief intervention that includes several key components. One is to reiterate, asking the client whether or not they've experienced an overdose and what that experience was like. Second, we want to briefly discuss what is an overdose itself. What does it look like? What's going on in the body? And what are the primary risk factors for an overdose, including mixing different substances, using after a period of abstinence, or using drugs of an unknown quality and strength. The third component is how to respond to an overdose. So asking the client if they've ever seen an overdose and what they did to respond. A lot of times clients will have lots of information about how to respond to an overdose that includes some myths that are not always particularly accurate. We want to provide the client with some information around how to properly respond to an overdose, including calling 911, administering Naloxone, or providing rescue breathing and other first aid. The client can be provided with a Naloxone kit on site or a prescription for a Naloxone kit, which is discussed elsewhere in the webinar. The materials that the provider can also provide can show some graphics if that's helpful in having the conversation. There's different types of materials that have been developed for different populations, including prescription drug users, also family and friends of people who are using drugs, or people who are primarily heroin users. Different types of materials are provided on the web, and here are some examples, including a brochure made for prescription drug users with graphics on the back showing the different components of overdose response, including calling 911, rescue breathing, and administering Naloxone. Other brochures, like this one, are more general and geared towards worrying about a friend or family member overdosing. They also provide information and graphic instructions on how to respond to an overdose. Integrating overdose prevention messages into a treatment setting is a wonderful way to convey to your client that you care about them even after they leave the treatment setting, that we care about their lives, their communities, and their families.